Hi, this is Dr.Jayanthy Ravindran, and today let's talk about nose surgery or rhinoplasty and the questions that most of you have regarding this procedure. Will I get the shape that I desire after the procedure? Will I get a scar after rhinoplasty? Difference between an open rhinoplasty and a closed rhinoplasty, reservation rhinoplasty. You see the final result after a rhinoplasty. About the anesthesia for rhinoplasty. What are the common complications that most people encounter after procedure? Function of the nose. Who is an ideal candidate for rhinoplasty? Correct snoring. Hi, this is Dr. Jayanthy Ravindran, and today let's talk about nose surgery or rhinoplasty and the questions that most of you have regarding this procedure. So, one of the common questions that most of my patients or clients ask me is, will I get the shape that I desire after the procedure? That totally depends on what your expectation is. For example, some people bring some photographs and they think that that particular nose their face is going to make their face look better, and they want a nose exactly like that. Their underlying bony structures, the rest of the bony structures of the face may not give the ideal outcome like what they perceive. Most of the time, this is a confusion between the surgeon and the patient during consultation. So usually, patient or a client presents with definite concerns or problem. For example, if a client comes with a dorsal hump and she says she wants the hump to be corrected, and the surgeon, while examining and evaluating her, also finds out that her concern coincides with his or her finding, then we both agree on correcting that particular concern. Some patients might feel that their nose is broad. Some patients might feel that their tip is droopy. Whatever be it, both the surgeon and the patient or the client should agree upon the concern that the patient is pointing towards. Many a times, I have clients coming to me and their presentation is, doctor, you tell me what correction that I should do on my nose so that it looks better. This is a very vague question because we do not know what exactly you have in mind as you think is the ideal nose or a nose that's going to look better in your face. So most of the time they end up having unsatisfactory results. The next important question that many of them ask me is, will I get a scar after rhinoplasty? That depends on what type of rhinoplasty you undergo. Rhinoplasty could be an open rhinoplasty or a closed rhinoplasty. Difference between an open rhinoplasty and a closed rhinoplasty is a small incision or scar have on the columella. Columella is the middle bridge portion of your nose. If you have a small scar here, usually this is there in open rhinoplasty. In closed rhinoplasty, you still have a scar, but it's not visible outside. The incision is made inside. So the difference is, when say it's an open rhinoplasty, basically you deglove or remove the skin of the nose so that the surgeon sees the inner structures under direct vision and corrects whatever deformity that is discussed between the patient and the surgeon. So between open and closed rhinoplasty, the actual difference is only in the way the incision is made and the type of scar that will result after the procedure. There is a terminology called preservation rhinoplasty, where it is a technique based on which a surgeon does the rhinoplasty. So in preservation rhinoplasty, basically we try to preserve the outer sort of a shape or the shell of the nose and correct the problem from deep under, so that it preserves the original contour of the nose. For example, let's say somebody presents with a dorsal hump. Dorsal hump is you have a bump on the outer surface of the nose. And if you do a preservation rhinoplasty, what we do is we push that hump down, that is, we reduce that height by removing a piece from underneath. Ideally, in an open rhinoplasty, we may shave away that hump. So shaving away the hump, it could be done either via an open or closed rhinoplasty technique. Whereas in preservation rhinoplasty, you remove some tissue underneath and push this hump down. So this is the terminology that is used for what is called a preservation rhinoplasty. And depending on the experience, the results vary from surgeon to surgeon. It doesn't mean that doing one particular procedure will give a superior result over the other. It is basically depending on how the surgeon analyzes the deformity and corrects it. The next important question is when they could see the final result after a rhinoplasty. What you must understand is after major rhinoplasty procedure, usually there is significant swelling in the nose, and this swelling is because of the edema, and usually 80% of the swelling roughly settles down between 6 and 8 weeks, but still about 10-20% swelling could still be there at the tip and in some part for even about 6 to 8 months. And because of the swelling in the immediate post-operative period, usually final result modification that's done internally is not visible soon after procedure. So you have to understand that following rhinoplasty, it takes about 6 to 8 weeks for you to understand how the final outcome is going to be. A little patience is required. So this is very important for someone because many a times some of my clients are unhappy in the immediate post-op period. Their main concern is saying the tip looks a little bulbous or the nose a bit turned, but most of them after about 4 to 6 weeks they are all happy and it settles down. The next important question is about the anesthesia for rhinoplasty. So some surgeons are comfortable doing it purely under local anesthesia with or without intravenous sedation. Sometimes people call it twilight anesthesia or whatever it is. But some are comfortable doing it under general anesthesia. What you must understand is this depends on the kind of all the steps of the procedure that is being discussed. For example, when we try to do osteotomy or the fracture the bone in order to narrow down the nose, sometimes it's not very comfortable under pure local anesthesia. With some intravenous sedation, sometimes this is done, but usually when such extensive procedure is being planned, some of the surgeons are comfortable doing general anesthesia. Now the most common concern is not because of the anesthesia, it's because people fear general anesthesia and they think that general anesthesia can cause death and other factors. So what you must understand is today anesthesia has advanced so much that inhalation anesthesia or daycare anesthesia, ambulatory anesthesia, there's so much of advancement that's coming and it's very, very safe. It's as safe as doing a local anesthesia most of the time. So you should be assured that you should allow the surgeon to decide what kind of anesthesia he or she is comfortable in doing the procedure. That's more important because we have to be comfortable while doing the procedure to deliver the best results. What are the common complications that most people encounter after the procedure? Rather than saying it's a complication, I would say that the thing that I would that I encounter and need to address in the immediate post-operative period is concern regarding the final outcome of the nose. So we all discuss what is the shape of the nose that someone desires, whether it's a hump reduction, whether it's a size reduction, base reduction, everything. Most of the clients think the day after the surgery or the moment the splint is removed in the first 48 or 72 hours, they would see the nose that they dreamt of or was discussed. And it is not so. So the most important thing to note here is you will have to wait patiently for a period of 4 to 6 weeks to see most at least 90% of the final outcome. There could still be edema, which as I mentioned can take around 6 to 8 months. You will have some bruise depending on the kind of steps of the procedures. There can be some numbness in the skin here and there, and sometimes when a base reduction, or we call it alar reduction, where we reduce the base of the nose, you can have some scar and in your columella, and the visibility of this scar takes around 3 to 6 months to completely become least visible. So these are things that you need to keep in mind. Another question to be addressed is regarding the function of the nose. Sometimes patients with deviated septum or the bent septum also present with breathing problems. In addition to this, there could be other reasons that someone has a breathing problem. So rhinoplasty or the nose surgery is not just about cosmetic correction. It is also trying to address these functional problems that a patient or a client might have. So many a times we get a CT scan that helps us to understand the inner structures. If there is a deviation in the septum, at what level the deviation is, and that needs to be corrected. So when you choose your rhinoplasty surgeon, it is very important to understand that for you to know that whether the surgeon also deals with functional correction of the nose, or at least there are surgeons who are part of the team who correct these functional problems. So whenever rhinoplasty is done, both the structural as well as the functional problem of the nose have to be addressed together. That's very important. So who is an ideal candidate for rhinoplasty? There could be many answers for this, but in my opinion, when a client or a patient comes to me for a rhinoplasty, if I would like to take up a client for correction, both myself and the client should agree upon the deformities or the concerns and should agree upon the correction that it is to be planned. For example, someone feels that their nose is broad, while I feel that the nose is appropriate to that face. If I attempt trying to narrow the nose, most of the time I might end up making the client unsatisfied after this procedure, because it is very difficult to perceive what they want as a final result. So what is important is the concern raised by a client while correcting the shape of the nose or correcting certain deformities have to coincide with the clinical examination and finding that during the assessment, and that will help us to get the best results. And when both of this coincides or syncs, that's when I would say is an ideal candidate. The next important question is regarding the age at which a rhinoplasty could be done. If a rhinoplasty or a correction is to be done for an accident, then usually if it happens in childhood, certain fractures that can be attempted to be corrected, but ideally a shape correction or a contour correction should be done when the development of the nose is complete, which is between 17 to 20 years of age for both men and women. Exceptional situations like a cleft nose, where correction can be done much earlier, even between 14 to 15 years of age. Some surgeons do it even during the primary procedure, at a younger age. But for a cosmetic or aesthetic correction, it is best to do after the full development of the nose, which is between 17 to 20 years in both for men and women. Another question to be addressed is, can rhinoplasty correct snoring? So it's not true always, because the reason for snoring could be many. People when they have a lot of fat deposits around neck and when the tongue falls back, there could be hundreds of reasons. So if the primary problem for snoring is only in the nose and that particular functional problem is corrected, then it will correct snoring, but not all the time. So rhinoplasty is not a solution for snoring. Follow our YouTube channel for more such informational videos.